Well, let's now take a look at the situation in metros, and daily cases seem to have started crossing the third wave peaks. In Mumbai, at least, cases are down from the peak by 88%. 2,550 new cases were reported yesterday. That's 28% lower than the day before. If we talk about the capital, then 9,197 new COVID cases were reported in Delhi. The positivity rate is down to 13.32%. And however, if we talk about Karnataka, well, there the cases have crossed 50,000 in a day, and Bengaluru is reporting over half of these cases. The positivity rate is a huge 22.77%. Well, to talk more about the third wave, we're now joined by Dr. Dhiman Kahali, Director, BM Birla Heart Research Center, and Dr. Hrishikesh Pai, Senior Consultant, Lilavati Hospital, Mumbai. Thank you so much, doctors, for joining us. We were talking about, schools reopening in Maharashtra, which is a very welcome step. And there also seems to be a sense that perhaps now the trend is that at least in Delhi and Mumbai, that the cases may have crossed the peak. First to you, Dr. Hrishikesh Pai.
Yeah, I think good morning, everybody. I think that we have crossed the peak, and there is a study that has come from Madras IIT which has shown the RR rate of 1.57. So I think in the next 2 weeks, India will peak as well. So I think it's a very good sign. We have, the particular strain of the virus is highly infective, but it doesn't have that much admission in the hospital. So, and there's not that much of morbidity. And probably the vaccination, most of the healthcare workers have taken the 2 doses, and the third dose is also going on. That may also increase the immunity to a certain extent. Also, the community immunity is where the vaccination program in Mumbai has been very, very well organized and very effective. And I think all that has the task force has done a very great job in implementing the program very aggressively. And that has given us very good fruits now. We are seeing the fruits of what effort was taken in the last 1 year. The fruits are being manifested just now in the form of the falling rate of the disease.
Right, going for the vaccinations. Dr. Pai, talking of science, the genomic panel, the genomic consortium has said Omicron is in community spread in the metros, but they've also spoken about this particular sub-variant of Omicron, BA.2, and that has also been found in high numbers, and that's something that scientists across the world also watching closely. So, we are still going to see new variants emerging, and that's something we have to keep an eye on.
Yeah, I think that if you look at the past pandemics, there have been smaller peaks that have come. And as my co-panelist has said, now probably the pandemic is on the wane, but we'll still see some smaller peaks maybe in the next 1-2 years. We don't know because the variants may change. But, I think the shift has to be from the numbers to the actual admissions in the hospitals which need ICU care or oxygen care, because I think community spread has occurred, and a lot of people are not doing the RT-PCR tests at all. I know a lot of people, if they have fever, they just they do rapid antigen tests and they quarantine. So we don't know exact figure, and so we should not go on the figures. What we should look at is what is the end point. What is happening at the hospital level? Are there patients who need oxygen? What are the patients that are going to the ICU? What is the mortality? So let us now shift our focus from the numbers to the actionable point. So what happens is that we keep on taking precautions, but we know that community spread has occurred. We can't do anything about it. People are not doing the testing. So let's look at the actual end point. So I think from the end point view, this disease is milder. We are, I think, very lucky this time, and maybe we'll come out of it more wiser.
All right. Well, that's the hope. Thank you so much, doctors, for joining us on the program this morning. Thank you.
Thank you.